So I didn't realize that I hadn't taped the last few slides regarding the tongue. So here are the last slides for your viewing pleasure. So question, the extrinsic muscles of the tongue are named for their action, innervation, insertion, or origin. So we know the styloglossus originates on the styloid process, and the genioglossus originates on the genial tubercles. So the answer would be D, their origin. So this patient was instructed to stick his tongue straight out. So see how it's deviating over to the left side? What might this indicate? So a unilateral lesion, meaning on one side, of the hypoglossal nerve causes the tongue to deviate towards the affected side when it is protruded. So when the hypoglossal nerve is damaged on one side, the genioglossus muscle is paralyzed on the affected side. As a result, the healthy or innervated genioglossus on the opposite side dominates the tongue across the midline towards the affected side. So when the tongue is protruded, it will deviate to its paralyzed side. So the lesion on the hypoglossal nerve here will be on the left side. So let's do an innervation review. So cranial nerve 12, or our hypoglossal nerve, is a motor nerve to the muscles, except for our palatal glossus. Vagus cranial nerve number 10 is the motor nerve to the palatal glossus muscle. Cranial nerve number 5, noted here by the Roman numeral 5, which is V. So V3 is the mandibular division of the trigeminal nerve, provides sensory information to the anterior 2/3 of the tongue. Cranial nerve number 7, which is the facial nerve, and a branch of that facial nerve known as the chorda tympani, provides taste to the anterior 2/3 of this tongue, so the apex and the body. And then cranial nerve number 9, or the glossopharyngeal cranial nerve, provides taste and sensory to the posterior third of the tongue. So the tongue itself is often a good indicator of overall health. And we want to check the lateral border of the tongue and the floor of the mouth for any signs of oral cancer. Any red, white, non-painful lesions on the lateral borders of the tongue. These are very common sites for oral cancer. So that's why it's important to put your mirror in to check way down at the base of the tongue on the lateral borders. And here are some images of oral cancer on the lateral borders of the tongue. And then this is oral pharyngeal cancer. So it's usually caused by human papillomavirus, HPV, oral HPV. So the same types of human papillomavirus that infect the genital areas can infect the mouth and throat. And HPV found in the mouth and throat is called oral HPV. Some types of oral HPV, known as high-risk types, I believe it's strain 16 and 18, can cause cancers of the head and neck area. Other types of oral HPV, known as low-risk types, can cause warts in the mouth or throat. And warts are good, not really great, but good in that they're not usually cancerous. So in most cases, HPV infections of all types go away before they cause any health problems. So what head and neck cancers can be caused by HPV? So HPV can cause cancers in the back of the throat, most commonly in the base of the tongue and tonsils in an area known as the oropharynx. So these cancers are called oropharyngeal cancers. And how common are these oropharyngeal cancers? Well, each year in the United States, about 9,000 people are diagnosed with cancer of the oropharynx that may be caused by HPV. And cancers of the oropharynx are about 4 times more common in men than in women. Only a few studies have looked at how people get oral HPV, and some of these studies show conflicting results. Some studies suggest that oral HPV may be passed on during oral sex from mouth to genital or mouth to anus contact, or open mouth or French kissing. Others have not. The likelihood of getting HPV from kissing or having oral sex with someone who has HPV is not known. We do know that partners who've been together for a long time tend to share genital HPV, meaning they both may have it. More research is needed to understand exactly how people get and give oral HPV infections.